We often get questions from patients why the implant cost varies a lot. So what is the cost of a single implant? At FMS, single implants cost varies between 24,000 to 60,000 depending on the brands of implant used, the quality of implant used, the type of implant used, also sometimes the clinical situation where the implants are placed. Sometimes we need bone grafting with barrier membranes placed for guided tissue regeneration, guided bone regeneration. Cost varies depending on the clinical situation as well. That actually decide the cost of an implant. The experience and the expertise of this implant surgeon is very critical, especially in compromised bone cases. Secondly, the type and brand of implant used. Thirdly, the technique of implant placement is also a very important factor when it comes to the cost. For example, placing an implant in an extraction socket is practically very difficult. So high skills are needed. Definitely the time factor, the skill factor, everything adds to the cost. So placing an implant in very thin bone needs extremely high skill. Also, placing short implants in critical areas like where it is approximating the nerve in the mandibular posterior region. Also, placing implants simultaneously along with bone grafting like sinus lifts. Certain tilted implant techniques, all on 4, all on 6, transnasal implants, zygomatic implant, pterygoid implants. Not every implant placement is the same. So actually speaking, it is a technique of implant placement which decides the cost most of the times. Full mouth rehabilitation with dental implants has such a varied range of pricing, ranging from 3.5 lakhs to 6.5 lakhs or 7 lakhs. Don't you think this sounds a bit expensive? I'll explain this for you. Well, it's true that simple, straightforward cases of full mouth rehabilitation with adequate bone isn't very challenging. In these cases, a choice of economical brands of implants can be regularly used. This isn't prosthetically demanding at all. They are simple processes like cemented crown and bridges. So the cost is definitely very economical in ideal cases. But when the bone quality and quantity is a concern, the whole scenario changes. For example, a maxilla with highly pneumatized sinuses. That means hardly any bone in the back teeth region on the maxilla. The complete implant technique changes, the prosthetic design changes, the cost changes. Here, advanced dental implant techniques like tilted, zygomatic implants, pterygoid implants, sometimes transnasal implants. These kind of techniques are implemented. They are surgically demanding and many times they are done under general anesthesia for proper implant placement, also patient comfort. These implants are specially designed, including their length and diameters, so everything adds to the cost. Now coming to the prosthetic part, it's a big change. Basically, there are two types of processes for full mouth rehabilitation: cementable and screwable. Straightforward cases, cementable can be an option which is simpler and economical too. But complex cases like tilted, all on 4, all on 6, zygomatic, pterygoid, always screwable processes is the option. So when it comes to screwable processes, there are various options. One is a hybrid processes where there is a titanium bar with acrylic wraparound. Another option is a mallow concept where there is a titanium bar upon which zirconium crowns are cemented. Also, the gum part is built up with composite material. So in all these processes, the titanium bars are expensive, which will add to the cost. The Rosen screw, all zirconium processes, which is milled from high quality zirconium blocks, which is also expensive. All these procedures fall into advanced dental implantology. So the expertise and experience of the surgeon, technology like digital impressions and workflow, in-house CAD/CAM lab support, everything is mandatory. So to conclude, in advanced dental implantology, everything comes with a cost.